Anxiety disorders include disorders that share features of excessive fear and anxiety and related behavioral disturbances. Fear is the emotional response to real or perceived imminent threat, whereas anxiety is the anticipation of future threat. Obviously, these two states overlapped, but they also differ, with fear more often being associated with surges of autonomic arousal necessary for fight or flight, thoughts of or imminent danger and escape behaviors, and anxiety more often associated with muscle tension and vigilance in preparation for future danger and cautious or avoidant behavior. Now, panic attacks feature prominently within anxiety disorders, but rather can be seen in other mental disorders as well. Anxiety disorders differ from developmentally normative fear or anxiety by being excessive or persistently beyond developmentally appropriate periods. They differ from transient fear or anxiety, often stress-induced, by being persistent, although the criterion for duration is intended as a general guide with allowance for some degree of flexibility and is sometimes of shorter duration in children. However, the typical lasting period is 6 months or more. Since individuals with anxiety disorders typically overestimate the danger in situations that they fear or avoid, the primary determination of whether the fear or anxiety is excessive or out of proportion is made by the clinician, taking cultural contextual factors into account. Many of the anxiety disorders developed in childhood and tend to persist if not treated. Most occur more frequently in females than males, approximately 2-to-1 ratio. Each anxiety disorder is diagnosed only when the symptoms are not attributable to the psychological effects of a substance or medication or to another medical condition, or are not better explained by another medical disorder.